All right, well, day 15, no sling right now. This is the situation. I had my post-op appointment with the surgeon yesterday, a checkup for 2 weeks. Went into the city, saw him, and basically said this is what the situation was. He remembers the phone call we had last week, and we talked about what was going on. So he removed all the little sutures that were on the little incisions, or not sutures, the little steri strips that were on the incisions. Took those off, took my sling off, and said, okay, let's do a little bit of physical assessment. Let's see how you're doing. Okay, no problem. So part of the subscapularis thing, he knows this is what the problem is, or this is where I'm claiming the problem is. So this is some of the tests you guys can see. So my right hand is my surgery hand, left hand is normal. So standing like this, I can move this elbow out easily. Hand off, I can move it out. All right? This hand, that's as far as my elbow goes. Unless I put pressure here to hold this hand, I can move it out slightly. All right? If I have no pressure here, that elbow does not physically move away from my body. It doesn't. So you're going to see here, this is where I am, hand off my stomach. It does not move. My whole shoulder moves. Nothing else. I cannot physically move my elbow out. If I take my hand and brace my other hand, I can get some flexion. That's as far as it goes right now. That's fine. It will not actually physically, my elbow does not move out. So he grabs my hand, says, okay, what's the situation? He goes, here you go. Can your elbow do this? And I said, nope. Showed him it wouldn't move out. It's my shoulder that moves forward. So, okay. So, okay, well, let's see from the outside. He said, can you go outwards here? I said, yeah, I got flexion out. There's some movement there. Okay. This side, same, more. But of course, I just had surgery, so everything's tight, which is fine. That's cool. He goes, can you go up? I said, yeah, a little bit. Like, starting to get some motion in there. Okay, perfect. So he puts his hand here. Goes, okay, pull against me. So I try to pull into my stomach. I have no strength. I can almost not touch my stomach. I can almost not get there. To do up my fly or my belt or anything on my pants, almost impossible. He's like, oh, well, that's weird. I said, yeah, it's the same as it was before surgery. And he kind of looks like, oh. And there was silence. And I said, like, this is what I was trying to tell you. I don't have subscapularis motion in my shoulder. And he was just silence. It was basically an oh fuck moment. So he, although I've told him numerous times, he saw it in person and realized, oh shit, something's fucking wrong here. And maybe he should have looked at more stuff, maybe. We'll see. So he claims maybe it's nerve issue because he still feels that in my shoulder, although the MRI shows a very serious tear, he said when he looked at it, it looked fine and he didn't warrant being fixed. So I have to go back in 6 weeks. He has asked me to schedule some physio, which I'm going to do right away here. Get out there to see the physiotherapist, see if I can get some range of motion back, some strength back. But he basically was in awe and in silence. He didn't know what to say. It was like, oh shit, I fucked up. So right now I'm doing some range of motion. You can see I do have some range of motion. I'm very, very easy on what to do. I'm only 15 days post-op, like I'm no problem left hand, but right hand's just a little bit of stuff. I'm not stressing anything. I'm just small body movements, nothing backwards really. I don't want to put my shoulder pitch it too much forward. There's too much pressure there. That's where it's been fixed, top and the inside. That's where dislocated is forward. So a little bit of motion, but I do have some motion. I feel pretty good. But this is what my range of motion actually is. Of course, I can't do much like pushing, lifting, whatever. I'm still being very easy, but that's the situation. Looks like I'm going to be back in 6 weeks to see the surgeon, and we're going to be doing some nerve testing maybe. He feels maybe there's some nerve damage, which maybe the assessment before surgery when I saw him in September would have been the best idea to see that, but he refused to do a physical assessment. He touched me more yesterday than he had previously in any of the appointments I've seen him or talked to him or anything. So not real happy, pretty frustrated, to be honest. It's exactly how I figured the appointment was going to go, and I'm fired up and pissed off. But the plan right now basically is do rehab for 4 months. We will see where you're at. If we have to go back in and fix it, well, we'll go back in and fix it. You feel like, oh, it's not a big deal. Despite me saying, you know, I haven't worked for 6 months, and I don't have 4 months to freaking rehab and not be able to work when it's all done. So that's the situation, guys. Unfortunately, it's exactly how I hoped it wouldn't go. And I don't know what to say. I'm just at a loss for words as to what's happened. Yeah, we'll see how this goes. Like I said, I'll have physio here. I'll book it. It's early January. I'm supposed to make an appointment with the surgeon February 1st to go see him again. Possibly do some nerve testing or arrange some nerve testing. I'm not sure how entailed that is. He never really said. But that's the situation right now, guys. I feel pretty good. Like I said, I'm doing my thing. Like, you know, I've got some range of motion, a little bit, whatever. Not a ton, but I'm going to start some broomstick exercises here this week just for passive stretching. Laying on my back, just using a broomstick with my dominant hand to move my hand, get some flexion back in and get some running range of mobility back in. So we'll see. That's the plan. That's the next 2 weeks from now through Christmas, New Year's. And hopefully right after New Year's, I'll get in to see with my physiotherapist in Saskatoon, make a plan with him, let him know what's going on, and we'll go from there. Not what I wanted to hear, not what I wanted to pass on to everybody, but that's the situation, guys. Merry Christmas, take care. Christmas is a couple days away. I'd probably make a video until after Christmas, in between Christmas and New Year's. But to everybody out there, Merry Christmas, Happy Holidays, and we'll chat soon. Thanks, guys. Take care, wish me luck.